Thanks for tuning in again to another episode in the Everything You Need to Know series. This time, I'll be talking about STIs, or sexually transmitted infections, focusing on their prevention, treatment, signs and symptoms, and highlighting risk factors. I will also be going a little more in depth about HIV in particular, as worldwide it is the most prevalent STI that has done untold amounts of harm to countless people. I want to first begin with what an STI is and what you can do to prevent one, as well as certain risk factors for getting them. An STI is any infectious disease that is spread through intercourse between persons. It doesn't usually matter what route the pathogen is transmitted, just that the main way you get it is through sex. Some common STIs you may have heard of include gonorrhea, chlamydia, trichomoniasis, or trick for short, bacterial vaginosis, syphilis, herpes, and HPV, or human papillomavirus. Preventing an STI is fairly simple if you know how they're transmitted. STIs commonly travel in vaginal secretions, semen, saliva, or blood. Create a barrier between those and you've prevented an STI. However, some will make a home in pubic hair, so even skin-to-skin contact can cause transmission. However, using something like a male or female condom can stop STIs in their tracks. If a partner has an STI and just needs short-term treatment, refraining from intercourse until it clears up will do just fine. For something like HPV, getting your vaccine can greatly decrease the risk of harm from infection, as HPV, like I mentioned in the previous episode, can cause multiple forms of cancer. Some risk factors for acquiring an STI include having multiple partners, young age, being intimate without protection, and for HIV, blood-to-blood contact and needle sharing. There are statistics that show STIs are common among LGBT+ individuals, and the reason for this is unclear, but for MSM, or men who have sex with men, this may be because seminal fluid holds a more potent amount of infectious load than vaginal fluid. The vagina itself also acts as a barrier against pathogens because of its unfavorable pH, which causes many germs to die before reaching anywhere vital. I want to discuss PrEP, or pre-exposure prophylaxis, in detail. When you see advertisements for PrEP, you're seeing an antiretroviral that's taken to prevent infection with HIV. HIV itself is what we call a retrovirus, meaning instead of going from DNA to RNA, it goes from RNA to DNA when converting its cellular materials. That's the reverse order. Usually most viruses and cells go DNA first, then RNA. As such, along with it being a virus that replicates copies of itself and then causes that cell to die, we need a different approach than, say, if HIV was just a run-of-the-mill bacteria. PrEP can be given to anybody that is sexually active, whether they are in a long-term relationship or not. They do not have to have HIV risk factors to get it, because some people might not want to disclose certain behaviors to their PCP. Some people who might benefit most from a PrEP prescription are people with an HIV-positive partner, whether they have an undetectable viral load or not, someone who has one or more partners of unknown HIV status without consistent condom use, someone who has a bacterial STI in the past 6 months and is either MSM or heterosexual, and people who have injected drugs in the past 6 months and share equipment. Note that before PrEP can be given, a person must be HIV negative and undergo testing. This will be an HIV antibody plasma test or rapid blood test. If the person has reported exposure to HIV in 4 weeks or less and or is showing clinical signs of HIV, further testing is also warranted. If they are not showing signs and they have not been exposed, a negative test result is enough. If they test again and their antibody assay is negative, they can receive PrEP, but if positive, they must undergo HIV treatment. The long and short is this. If a patient has a negative antigen antibody test and an undetectable HIV-1 RNA test confirming they do not have HIV, PrEP can be prescribed. However, if a patient has both a positive antigen antibody test and a detectable HIV-1 RNA test confirming they have HIV, they get treatment. If the results are ambiguous, no PrEP can be prescribed until HIV status is confirmed or ruled out. This is very important. If someone with HIV gets PrEP, They might develop drug resistance in their early stages, which causes major problems later on, as they have less medication that will work on controlling the disease's progression. Before getting PrEP, a doctor will also check liver function, kidney function, and assess if you have hepatitis B before starting anything. If you have kidney problems, the injectable form of PrEP might be better for you. PrEP typically comes in formulations with 2 pills, Truvada, Descovy, and Aprepitud. Don't ask me to say the generic names of these medications because I will definitely fail. There are also injectable forms. PrEP is very effective at preventing HIV. It's 99% effective when taken as directed. For injectable drugs, the effectiveness is at a lower 74% than with oral PrEP, but it's still very effective. The CDC notes, quote, "The estimate is based on tenofovir alone and not necessarily when taken daily. 2-drug oral therapies and taking oral PrEP medications daily may increase its effectiveness." End quote. There are no reported side effects from the oral pills, but the injectables can have injection site reactions like redness, swelling, and discomfort short term. For those who want to take PrEP when pregnant, it is safe to do so. Breastfeeding is also safe when on PrEP, so no need to stop if this is something you'd like to do. Discontinuing PrEP comes with decreased protection from HIV, of course. Immunity will begin to wane around 7 to 10 days after stopping the oral pills, so be mindful. For the injection, immunity wanes much slower during this period, and as a result, drug-resistant HIV can crop up. In this case, an 8-week oral PrEP regimen can be started. You will get tested during this time period, and if you're shown not to have HIV, you can continue with PrEP or choose not to. If you do have HIV, then a more intense drug regimen will be given to you to help with early treatment. Transgender and non-binary people who use gender-affirming hormones and have HIV risk factors can use PrEP. There are no known drug conflicts between PrEP and hormone therapy, and there is no reason why the drugs cannot be taken at the same time. PrEP can also be given to those younger than 18, although studies are less clear on the effectiveness. A teen can be given PrEP without parental consent, but this varies by location. In any case, as long as they haven't been coerced or assaulted, the only entity that needs to know about them is the health department if they test HIV positive. Otherwise, it's confidential. For people who inject drugs, especially opioids, PrEP can still be used and is encouraged. Since most people who use substances are also intimate, this reduces 2 risk factors in one. MAT, or medically assisted therapy, so think Suboxone or buprenorphine, and PrEP can be taken together. In addition, although I know this is a touchy subject and many places don't allow for it, if there's a clean needle exchange program near you, take advantage of that as another way to reduce your risk of something like Hep C. I think some doctors can also prescribe syringes or refer to a pharmacy, but I don't think this is a common thing. Medicaid and insurance all cover PrEP with little to no cost, so don't let that be a barrier for you. Visit your local Ryan White clinic and they should have something for you. Let's talk about how to make an environment friendly for teens and young adults who come in with concerns about STIs. First of all, contraception should be offered to everyone, not only those who can get pregnant. Partners might want to have these on hand in case, and it's always good to include them in the pregnancy and family planning process. It's also very important to let people who come in know that reproductive health care is free or low cost. Most insurances will pay for them, and because, from my understanding, most reproductive health clinics are actually what are known as FQHCs or FQHC lookalikes, they need to see people regardless of ability to pay. Sliding scale fees can be done. Secondly, all info must be kept confidential unless there's some kind of abuse going on, in which case all healthcare workers are mandated reporters. Third, STI testing will be offered, and it is only shared with the person, not their parents or guardians. If someone tests positive for an STI, they are notified, given medication, and encouraged follow-up. They might also be given medication for their partner if it's likely the STI might have spread too, even if they weren't tested. There should be clear signs up that are non-threatening, signs that talk about emergency contraceptive pills, HIV testing, birth control, you get the idea. Having same-day appointments is also really important, as many people don't have the opportunity to wait. It doesn't hurt to mention, especially for those who are active, that even during menstruation, pregnancy can still happen. Let's touch on how to take a good sexual history and what might be asked. Just a note, many people have experienced some kind of sexual trauma, which can make this process difficult and even emotionally painful. Tread lightly, and if someone doesn't want to disclose, that's okay. You don't have to tell anyone anything, remember that. Some people may also feel body dysphoria, especially transgender and non-binary individuals, so sensitivity is definitely needed. During the sexual history, some indications of intimate partner violence might come out. Again, you don't have to reveal anything, but know that your doctor has the responsibility to report, and they can also help you come up with a safety plan. There's 5 components to a history: partners, practices, protection, past history, and pregnancy. Starting with partners. This is generally where you'll be asked how many partners you had or have, if you are in a long-term, healthy, committed relationship where you feel safe, and if you've ever had a partner that made you feel unsafe. You might be asked about gender and sexual orientation, but again, if you don't want to reveal it, don't. Remember, intimacy isn't just penetrative, so you might be asked about other forms as well. A note for asexual individuals. This can be a very invalidating experience. Your doctor may not believe you, as stupid as that sounds, I know, and might try to get more information out of you about your history. I just recommend reiterating your identity and trying to navigate it with grace, but I get that this gets really, really invalidating, so good luck with that. Practices, ask about what kind of intercourse you're having and where you have it. Simple as that. This is necessary if a swab or sample needs to be taken. Sometimes the topic of using substances during intercourse or having intercourse for favors comes up. This might be uncomfortable, so just say no politely and move on if it doesn't apply to you. As I said before, providers encounter a lot of people during health checkups, and some of them are undergoing coercion and need help. Protection asks about how you and your partners protect yourselves during intercourse. This can be through birth control, barrier methods, etc. Now, I know mutually monogamous relationships are usually the standard, but there are many people who are in long-term relationships with more than one person, so as long as you know and they know that you're STI-free, I think it doesn't matter as much if you're monogamous or not. Your doctor will discuss what methods you use, how often, your perception of risk of STI transmission or pregnancy, what you know about STIs and other diseases like hepatitis. They might ask if you use PrEP or if you've been vaccinated against certain diseases too. Past history is as it sounds. These questions will revolve around your past history with any STIs, what treatment you got, if any, if you have recurring symptoms, and if your partner has ever had an STI. They might offer an STI or pregnancy test if you'd like one. Lastly, pregnancy is also self-explanatory. You will be asked about your intentions to get pregnant, if you've been pregnant in the past, and the course of the pregnancy, and you may be asked if you've ever either had a spontaneous or an induced termination of pregnancy. They might also ask about contraception and if you want any at the appointment. If you don't intend to become pregnant, you can say no and skip past this section. Additionally, if you don't want to become pregnant anymore or desire more permanent means of contraception, also mention that. If you happen to be pregnant at the appointment and you have a fear of harm to your baby or yourself, please be sure to mention this so you and your provider can develop a plan. And, although I won't be discussing it here, I will include a guide in the description for healthcare workers and non-healthcare workers to look at with regards to medication for different STIs and how long they're taken for. Lastly, if you think you might have an STI, what are some signs and symptoms to look out for? Genital itchiness, redness, discomfort and bleeding during intercourse, discharge, and this discharge can smell bad, be thick, and can look either yellow, green, or be frothy, which basically means it looks like foam. And you can also have problems urinating. Syphilis can appear as a canker or a painless boil on your genitals. Bacterial vaginosis has a characteristic fishy smell. And, just to ease everyone's mind, a yeast infection is not an STI. It's just an overgrowth of a fungus called Candida. If you've ever seen a baby with thrush in their mouth, that's the same thing, just in a different location. It's treated with antifungal creams you can buy over the counter. If you think you might have an STI, the best thing to do is just get tested. I can't guarantee it won't hurt, but an untreated STI can cause infertility, a greater risk of miscarriage, ectopic pregnancy, and pelvic inflammatory disease. Also, some of them have an even greater risk of harm if left untreated, especially HIV, which can develop into AIDS, or acquired immunodeficiency syndrome. AIDS is irreversible and, although it can be slowed down with medication and treatment, it is ultimately fatal. So, please, make sure you are protecting yourself and others. Treating an STI is quick and, at most, should take you a couple weeks of antibiotics, although some can stay dormant and reoccur. Thank you so much for tuning in. Please stay safe out there and look forward to more videos. I hope you all have a good day. Bye.